Hi, and welcome to the Institute for Restorative Health. I'm Dr. David Jowdy, and today we'll be talking about bringing balance to your autonomic nervous system. Please be advised that the content of this video is for educational purposes only. This is not intended to take the place or be the substitute for any professional medical advice. So if what you're hearing clues you into something on a medical level, please consult with your physician about that. This is one part of a series of lectures that we will be putting together on what we call our bio-restorative matrix. This is the system or the process by which we look at health and how we at the Institute for Restorative Health help people regain their health. Our ideal outcome in this is to reclaim, restore, and renew your health in mind, body, and spirit. So let's get into it. Let's talk about improving your physical health through balancing your autonomic nervous system. The first key to this is, what is the autonomic nervous system? So let's break this down into two parts. The first part is your sympathetic nervous system. This is your fight or flight. And the second part is your parasympathetic nervous system, and this is what helps you rest and digest. Typically, when these systems are out of balance, or if you are, let's say, stuck in one system or the other and can't balance out of one and into the other, there's a myriad of symptoms, especially physical symptoms, that your body can manifest. First, let's look at the activity that goes on in each of these separate systems. We're going to start with the sympathetic activity. The sympathetic nervous system, as you can see by the picture, would be something that is active when you are active. If you're running a marathon, if you're being chased by a lion. Okay? In ancient times, this system would be only activated if there was a major threat or major danger that was affecting you at that time. So what increases in your body? Blood pressure will increase, heart rate will increase. Your fuel availability, so your body's ability to break down sugars and fats for usable fuel at that moment, will also increase. And you could have an adrenaline rush or a surge of adrenaline. Oxygen circulation to your vital organs. And these are when we say vital organs, heart rate, heart, lungs, the brain, the organs that will keep your body alive. Blood clotting minimizes the loss of blood if you were to be wounded. I would say many people would think that if they're sitting watching a television show, they wouldn't be too worried about loss of blood or being wounded at that moment. But in an emergency situation, or if you were injured, your body would go into this sympathetic drive to increase wound healing. Also, your pupil size will change, and your peripheral vision will improve so that you can see what's going on around you. Now, there are also systems, or there are things that will decrease at this time. The first is fuel storage. An example of this is decreasing the amount of insulin activity in your body that would cause you to store glucose. If you had an increase of insulin, you'll see this on the next slide, that would do the opposite. Digestion and salivation will also decrease during this time. If you've watched a marathon before, there aren't too many marathon runners that are eating a meal while they're running. So digestion is not a priority when your body is in sympathetic tone or sympathetic drive. If we look at the parasympathetic activity, again, the rest and digest activity, this is when digestion would then increase, and your body will prioritizing breaking down your food and assimilating the nutrients. Intestinal motility is a part of that, so the movement of things through your GI tract. Fuel storage. So in this instance, your body would be storing fuel away for when it needs it later, primarily when you would be in sympathetic activity. So more insulin activity would cause that fuel storage. Also, resistance to infection is high during this time. Rest, recuperation, this is when your body will heal. Circulation to non-vital organs. This would be the skin or the extremities and other organs that we call non-vital, and this is where the nutrients would go to those organs to heal during this time. Also, endorphins, which are our feel-good hormones, are going to be activated or increase during parasympathetic activity. So what decreases at this time? Heart rate is going to slow down. Blood pressure is going to slow down, and typically our body temperature will go down as well. Now, none of these are going down into a rate that would be detrimental to our body, just a more relaxed rate. So when we say temperature might decrease, that doesn't mean our body temperature would go from 98.6 down to 94. It would just go on the lower end of the normal scale. Whereas with sympathetic activity, it might rise considerably while our body is in motion. So what happens when our body is not regulating? It's not going back and forth between the sympathetic and parasympathetic nervous systems appropriately. This is what we would call autonomic dysfunction. So these symptoms that we're going to talk about a little bit don't necessarily clue us into what aspect of the sympathetic or parasympathetic nervous systems we're in, but just that the balance between the two is off. Dizziness, fainting upon standing, what's called orthostatic hypotension. There's also a term you'll hear called POTS. That would tie into the autonomic dysfunction category. Inability to alter your heart rate with exercise or an exercise intolerance. That would be more than likely that's when your body is stuck in parasympathetic tone, but it could be both. Your body is not able to raise the heart rate, or if your heart rate gets up, it's not able to calm it back down. Those are both significant problems when it comes to exercise and autonomic dysfunction. Sweating abnormalities, and you could go alternating between either too much sweating or not enough. The body, when you sweat, that's the body's mechanism of cooling itself off. So that is a vital regulatory function that when your autonomic system is off balance may not happen. Digestive difficulties, you saw in the previous two slides that there's a lot that talks about the changes in the GI system from one part of the nervous system to another. So loss of appetite, bloating, diarrhea, constipation, difficulty swallowing. Your body basically saying, I don't need food right now, so I'm not going to accept that. It could be a rejection aspect of dysfunction. Urinary problems, difficulty getting started, incontinence, incomplete emptying of the bladder. These are all also signs of autonomic dysfunction. Visual problems would apply here as well, whether your vision be blurry, inability of the pupils to react appropriately to light. When bright light comes on, your pupils should close down, limiting the amount of light getting in, so it's less of an irritation. If that doesn't happen, then our vision is going to be impaired somewhat significantly. So those are the general dysfunctions, but if we look at the dominant side, this would be, okay, so a normal or appropriate autonomic function is you go into the sympathetic nervous system when your body is under stress or sees a threat, and then when you're ready to relax or when your body recognizes that threat is gone, then you will go back into the parasympathetic state. And over the course of a day, you can balance in and out of these states, numerous times. When you are dominant in one of those states, in this case sympathetic dominance, that means you're stuck in that fight or flight. And your body's not adapting well, it's not getting out of that stress mode easily or well or sometimes at all. There are individuals that we will see stuck in these states 24 hours a day. And when that's happening, these are the signs of that. These are the symptoms that might come along. I won't go through all of them, but we'll hit on some of the bigger ones. With sympathetic dominance, sensitivity to light is really common. Someone who's a light sleeper but still has very vivid dreams. There's a lot of activity. Busy brain is a good term that goes along with this. Upsets in digestion, of course high blood pressure, tiredness. If this has been going on for a long time and it's a chronic problem, then your body will run out of fuel and run out of energy pretty quickly, and you'll feel tired a lot. Difficulty losing weight. We see irritability and headaches as major symptoms that go along with this as well. And then that will even progress into hormone imbalances like the thyroid imbalances, and for women PCOS or polycystic ovarian syndrome is very common. One thing that's not on here but is kind of a trend that you can see is inflammatory type processes tend to stay elevated during times of sympathetic dominance. If we look at the parasympathetic side, parasympathetic dominance would be someone who has a hard time getting going. So if you think of that fight or flight, your engine is constantly revved. In parasympathetic, you're having a hard time getting the engine to turn over. Depression is pretty strong in this one. Lower blood pressure, lower heart rates, fatigue. Those are probably the most common symptoms that we would see here when someone's in parasympathetic dominance. As we get further down the list, there's a lot of neurological or cognitive impairments that go along with this too. Confusion, slow thinking, really difficult times organizing your thoughts. If you have that going on, then the thought is you might be stuck in the parasympathetic state. So within all of this, how do we create that balance? What is it that we can do for ourselves that can create a level of autonomic balance, help take us out of one of those states and be able to balance into the other? Some simple solutions that I think anyone could really implement and potentially see some change from would be exercise. Exercise is a way of forcing your body to get from an inactive to an active state, and then afterwards you're going from an active to an inactive state. So it makes sense that there would be some sympathetic and parasympathetic changes that go on there. So that would be initiating that process for your body. Sleep is another one. The more you sleep, the more you repair. Sleep is a predominantly parasympathetic activity. So especially if you're stuck in the sympathetic state, the more rest, the more sleep that you can get, the better. Meditation, stress reduction, and even breathing, you could mold these into one and do this all at one time. But anything that you can do for stress reduction to reduce the amount of stress on your body that the outside world creates. We as individuals tend not to breathe as well as we should, so deep breathing exercises can help to facilitate the activity within the autonomic nervous system. And of course, eating healthy is a big piece of this as well. We can blame autonomic imbalance on why our digestive system may not be working or functioning the right way, but what could have stressed the digestive system to create the autonomic dysfunction in the first place? Chemicals, preservatives, toxins, anything that we're getting in our food that's not natural. So the healthier, more natural, more organic diets that we eat, the better chance we have of regulating our bodies effectively. Now, if we take a step forward and we start looking at some of the clinical ideas that go along with autonomic imbalance, this is a depiction of what we use here at the Institute for Restorative Health for assessing and addressing any level of autonomic dysfunction. And we use heart rate variability. To me, that is essentially the gold standard in testing autonomic dysfunction, and it allows us to look at a person's stress responses and determine if they're stuck in one state or the other, or where they might need help creating more balance. So as you see from these charts, this is a depiction that comes from the software that we use that would show a person's sympathetic, parasympathetic tone, and this one actually talks about a secondary system that's called our neurohormonal backup system. So in red, you would consider this your reserves. You can blow through your autonomic function to the point where your body is looking for a secondary stress reduction mechanism. And once you've done that, your body's already in a pretty strong stress state. So this actually shows a patient that was in pretty good balance from their parasympathetic and sympathetic states. They were fairly even, but they were very low on their reserves. And what was done is we will retest folks a week, 2 weeks, or somewhere along the lines into that process to see that the interventions that we're using for them are making the corrections that we're looking for. So this was a 4-day difference with one patient that went from not enough of a backup system to a pretty good backup system there, and you can see almost equal pieces of all three of those parts of the pie there in how their body is reacting to stress. So this would show us that the individual had a very favorable response to the interventions that we were doing clinically for them. Also on a clinical level, we will look at different solutions that we might implement that are outside of the meditations and the eating rights and the things that you can do on your own, where the body needs a nudge. It needs to be pushed a little bit in the right direction, or maybe it needs something slowed down a little bit to create that balance. And once that balance is created, it's a lot easier for that person to maintain. Some of the therapies that we find most beneficial in helping create autonomic balance would be sound and vibrational therapies. And we'll use a multitude of those types of therapies here at our clinic. But two of the main components of that, number one would be binaural beats. This is a way to retrain the left and right brain to be communicating appropriate signals to each other, but then also appropriate signals to the rest of the body. And what that also ties into is brainwave activity. And as you can see here on this depiction, this is something that we can find from the same software that we use to test heart rate variability to see how much activity might be going on in the different brain waves of the body. Delta being the slowest, gamma being the fastest brain waves. And what you can see is that over a course of time, you could also put certain interventions into place and then see how the brain waves adapt to that. So as you can see here, the theta waves were very high and they went down considerably during treatment, and some of these others that were a little bit lower were able to go a little bit higher. So this is just a depiction of how brainwave activity could potentially change even in a short period of time by implementing some of these sound and vibrational solutions for autonomic dysfunction and stress dysfunction. Some other things that we look at clinically to create that level of balance. Now these would be therapeutic ventures. HeartMath we have found to be incredibly helpful. Not only is that an intervention that we can introduce to our patients, but it's something that we can teach them to do and be able to continue that process moving forward. And HeartMath utilizes heart rate variability in a way of synchronizing the brain and the heart and creating a coherent effect between those levels of communication. Vagus nerve stimulation. Many times when people see stimulation, they think that you're stimulating the nerve, but the reality is we're creating a stimulus to the nerve, and that vagus nerve, which is one of the larger nerves in the body, it helps to control heart rate, it helps to control breathing, it helps to control digestion, and if it is out of balance, then we can see autonomic dysfunction from that. So the stimulus applied to the body regulates the vagus nerve. It's not just nerve stimulation, it's a stimulus effect on that nerve. We have found that patients with elevated blood pressure would have their blood pressure sometimes reduce from vagus nerve stimulation, but someone with lower blood pressure might see their blood pressure slightly rise. Both of those into a normal range. So the same therapy applied the exact same way with two different people would create opposite effects. So to us that proves that it has more of a balancing effect than an all-out stimulatory effect for the body. Very safe, very effective, and very simple to use. We use a device called the CES Ultra. Massage therapy is also a really, really great tool for bringing a relaxing state to the body. I would say probably more often than not, it's going to be someone in a sympathetic overdrive that gets a balancing down to the parasympathetic state from massage, but it could certainly create activation in the body by way of blood flow and lymphatic flow and muscle relaxation. So massage therapy is another great way at creating autonomic balance. One thing I omitted from this slide, but nutritional supplements, there's a multitude of ways that could create autonomic balance. So that would be something that would help support a person through their journey on trying to create more autonomic balance in their life. These are also things that can be done ongoing and continuously, whether a person is being treated clinically or not. HeartMath, vagus nerve stimulation can both be taught and done at home, as well as massage therapy. But these are things that you would not want to implement without the help of a healthcare practitioner first. Thank you for joining us today. I hope you guys all learned something. If you enjoyed what you saw, please like us and subscribe to our YouTube page. You can see us on Facebook, and you can check out our website at instituteforrestorativehealth.com as well. Take care.